Okay, my name is Livio Yoshinaga. What I'm going to do here today for you is the full DSD protocol using Raquel as a model, and I'm just open the template Keynote 6.2. If you have the old Keynote, you can find the template of the old Keynote, but for updating your material, we're going to use Keynote 6.2, which is the latest version of Keynote. So we have the template open. We don't want to mess with the template. I want to keep it original. So I'm going to duplicate. Instead of duplicate, I go on top of duplicate and I click the Alt key, Alt on my keyboard. So this becomes Save As. I click it here and I can give another name. So I'm going to give a name Neo Clinic. Neo Clinic. Why? Because I'm here in beautiful Bucharest, Romania, and I will replace the original Neo Clinic. So this is DSD, Neo Clinic. Now I changed the name, and what I've done, I have saved my original template. So the first slide, I keep her face here, and because when I close down this slide, her face will be on the icon, so I can recognize Raquel by name, or looking to the icon, I can recognize her by face. I have the next slides will be documentation, all of the photos that we've taken, the photos that are part of our protocol. We have a facial video, we have a close-up video, we have a functional video. So those videos are very, very important. You should go to the material so you can see and check those videos, how you have to do it. And this is another PDF that you have available to download. This is just showing the x-rays. I think you're all familiar with the template. The period chart if you want something. If you have, this is the communication tools. I'm not going to cover this on this clip. Medical history, white slide, black slide, and comes down to the template. So this is where we're going to start. So my second slide is actually her face, which we have the normal smile and the retracted smile. The first and what we need as a retracted smile is the first photo we take, because when we take this photo, she is holding the retractors. You are not seeing here, but behind her head there's a glove box, and on top of the glove box we put her cell phone. She doesn't move the head, so actually we don't want her to move the head. And then inside here the mouth, she can bite a jig, but on her case we're missing some elements here, so the jig here wouldn't work. So this way we can see the aperture of the mouth is a little bit different. Here's a little bit closed, here's a little bit opened, but we want to try even to get this aperture the best we can, the same as we can. So we take this photo first because it's easier to take out the retractors without moving the head, and this photo second. But we're going to use this photo first because I have all the structures from her face, so I can then take my decisions. So from here I'm going to click and do a Command C. If you are on the PowerPoint, you're going to do a Control C. We'll come back to our template slide and Command V. She comes always on top. We're going to send her back, and immediately I'm going to resize her head to match the ellipse. So I'm going to resize it. Her head, her face is inside the ellipse. The hair is out. Here's the hairline. Here's the chin. So now I can start playing and placing my lines. First line I'm going to place is across the eyes. So I'm going to zoom in to make sure that I am really in the middle of her pupilla. Right pupilla, left pupilla, perfect. Now I take the other line and I'm going to check eyebrows, top of the ear, base of the ears, and the most important, the commissuro alignment. The commissuro alignment is okay. I think this is a nice, we are lucky to have the picture, to get the picture at this position. I don't need to move or change or rotate her face. If I needed to rotate her face, I would go to range here, and then I could go degree by degree, finding the best horizontal position of our frame. Her whole face is a frame, and the smile will be designed inside this frame. So horizontal is fine. Click on her face. I go with the arrows on my keyboard right and left until I have found the best midline. So I look to the glabella, I look to the philtrum, and I make a nice, I use them as a nice reference to find the best place for her face, and trying to probably giving a little bit more attention to the philtrum if she has a very nice lip design. So now we've done the horizontal and the vertical alignment, and this is what we call the digital face ball. Let's duplicate the slide so you can have on the movie this slide, and this first slide here is the digital face ball. Now second slide, we're ready now to erase all those lines. We don't need those lines anymore. I'm just going to leave the vertical line, okay, and I'm going to use this curve so we can start now establishing and placing the smile curve. So I can see here that the midline of the face is on top of the 21. For this exercise purpose, when the discrepancy is very small like this, we do not shift. But unless the patient tells you this disturbs them, we have to maintain this. For Raquel, we're going to adjust the image, and we're saying we're not going to shift the midline. So I'm going to adjust. I'm going to click here. Let's just do what we've done on the exercise here. I'm going to leave this slide showing that there is a shift. So I remember this blue arrow here. Click on the slide, duplicate, erase the arrow, and then I'm going to disconsider that curve, that discrepancy. Now my curve, I have to take a look at the video and decide if I want to maintain the incisor edge position, if I want to shorten the incisor edge position, or if I want to lengthen the incisor edge position. Lengthen the teeth, changing the incisor edge position here. So we're going to give a little bit more exposure. That's what she wanted when she told us on the video. And now the curve, I can adapt the curve, look into her teeth, trying to make this curve as natural, as harmonic as possible, respecting her teeth position. Now we have done the smile curve. This can change later, but right now it's enough. So here now it comes to the interdental ruler. We're going to change until we find, in her case, if I go straight on the central here, using this as a reference, I can complicate a little bit my life here. So, like we said on the exercise, we're going to make my life a little bit easier. So I'm going to make this a little bit big. So this way now, I can redistribute this position. By the way, I have to really correct this here and put this right in the middle. Good. So now I can redistribute my widths, and then I can immediately release a little bit of the pressure, and we know we can distribute the teeth better here. That's nice. Let's duplicate the slide. And I don't need the midline anymore. I don't need her face anymore. It's going to be now just the mouth. And unfortunately, if I present this mouth like this, it's too small. So what I'm going to do, I'm going to group first and make this big. If I group it and make this big, I can have now a nice image, a nice size to present to my patient, and as well for me to start studying this case. I'm going to ungroup, and now I'm ready to continue my work by transferring. I need to transfer this image to the retracted photo. So let's add 2 lines here. As we did on exercise, I'm going to try to keep the same reference points. You can use the tip of the canine, you can use papillas. Here we are using 2 embrasures. I'm going to duplicate this line, and then the second line will be middle of one central, middle of the other central. And then a third line would come here, but as we're maintaining the midline here, and it's already aligned there, we're going to just keep those references. Duplicate the slide. We're ready to erase this photo and bring the other photo from our second slide. Command C, I come back here, Command V, and from this image, I really don't need the face. Why the face is there? Because we took the photos from the face, so this mouth has the same angulation and lens distortion of my photo camera. Now I make this big. I don't know exactly how big this is going to be, but I send it to back, and I just have now to line up my embrasures. This embrasures is way out here. If I don't remember the reference points, I come back here, I see this is my reference point, so this now is too big. So we're going to make this a little bit smaller until those embrasures fit. Now a little bit smaller, and probably this will be the situation here. So I'm going to zoom in, and I have to move this image and be changing the size until I can match it perfectly here. Perfect. Look at the centrals, look at the midline, look at here. Now I go back to my other slide and I keep changing this to see if they are on top. This is really nice, very precise, and this is only possible because we have taken the two pictures from the face. Duplicate the slide just to remember. I'm gonna erase the transferring lines, and we're ready now to use the proportion guides, because now I need my last curve. I'm gonna use 80% as a beginning, and I want to measure from Raquel the height. I know the width of the central, and I need to know the height. If this is my first guess of changing the incisal edge position, I'm going to line up this 80% proportion rectangle to this point. And then here, I'm going to make this smaller until I match the width. Now I can see on the cervical, and still, this is the height, this is the width, but I can then choose if I want to go towards the cervical area, if I want to go towards the incisal area, or if I want to go towards both. So you can decide here, look into the movie, hearing what she says, and also you can change this at the end of our project by moving the individual teeth here. So let's make sure we don't do a surgery here. This is the exercise we've done here in beautiful Bucharest. And we're going to adjust this curve. Now we have exactly 80%, a new proportion for the tooth, a little bit wide, a little bit long here. Now it's easy for me to take this curve, duplicate, position on my cervical area, adjust and redesign this curve so it's more adapt to her teeth structure. I will do the same here. Great. And I have now my smile frame. Let me duplicate here and let me show you what we call smile frame. Smile frame is exactly this. Are the places we can place teeth. So this is going to look nice with this proportion, with this position, respecting those two curves. So this is exactly a smile frame customized and facially integrated with Raquel's case. So now we're ready to start placing teeth here. Let's change and find this oval shape. That's what she asked us to do. And then we can ungroup and place the new teeth right here. So we can now distort this original teeth because I'm going to adapt this to her smile frame. So it is a customized design, and I have to now adapt all the proportion, all the size, remembering the central, it touches both curves. The lateral does not touch, doesn't touch the upper curve and the lower curve. The canine, it touches both curves, and the premolar does not touch. So it's a very easy way to remember yes, no, yes, no. Good? Let's take this, the 11 one, position it here. Good. Take the lateral here as well, is lined up there. You can see that Keynote gives me some reference lines helping me to position. If it's jumping from one position to the other, you have to press the command key at the same time. So then it will not jump. It's going to give you very smooth movements here. So now I have this position, and my final teeth, my final tooth is the premolar right there. Done. I'm ready now to duplicate the slide, and from here I need to start measuring. So I'm going to get this ruler, Command C, Command V, and as we know, we have to measure Raquel's distal to distal from the central, distal to distal measurement. So I'm going to bring two auxiliary lines, dragging a line from the ruler, making sure they are on the distal of the original tooth, right here, and on the distal of the other tooth, right there. I can bring now my ruler here, put the 0 here, and then I can see that I have to distort this image until it's 15.5. And this is a number that I have to give you, that you have to measure from your patient directly in the mouth, or you can measure this on the model. So here my ruler is calibrated, and I'm ready to do some calculations here. Let's say I want to design this curve on the model. So I'm going to place this ruler here and measure from the curve to the regional tooth. So here I have 2.5 millimeters. Then I can measure it here. This is 1 millimeter to the regional tooth. I don't measure on my design. Here's 0.5 millimeter to the regional tooth, because the regional teeth is what I can see on my model. As I find this point by the distance, I can start placing, designing with a pencil, this distance, a little point here on my model, and then at the end I can just connect the dots and I'll design my curve. Here I didn't put any ruler because it's 0. This curve is touching the cervical of the 21. Okay, so this is a slide for transferring the line, the curve, the upper curve to the model. Now my technician will have a line here designed on the gingiva of the model and a curve. So he has now full orientation on how to hold this model so he can do the perfect wax up for me. Now the second slide will be wax up. So let's now measure how much of the cervical and the incisal I need to increase. At the same time, I can also have a ruler inverted, and I can measure also how much I have to cover the gingiva. Okay? So now this slide is to transfer to the model. This slide is to guide my map, my project, so I can then have my technician doing my wax up perfectly. Next step, we're going to erase everything. Erase everything here. I don't need my auxiliary lines. And we're going to paint this outline with real colors. So you've seen how we can paint with her own color. Okay. And we can also paint with the original colors here. So let's take those original colors, bring it back here, ungroup, and this is not a perfect science, but we're going to try to cover the white lines, having the white lines as a guide, and then I can reposition my teeth here, so I can simulate for Raquel the new smile. So you can see as it's colored, it gives me, because of the light reflection, it gives me a very nice sensation of real teeth. So it's a little bit dark. We're going to take care of this in a moment. So we're going to do a nice digital bleaching on Raquel. We can, of course, dehydrate teeth as well. So let's do this. Let me rotate a little bit this. I want to rotate this premolar a little bit. Perfect. But I can see that I have those lines, some white lines here are showing up. So before I even bleach, let me just get all those teeth here, group, and send it back. Now I can select all my white lines, holding the shift or the command button and erase. Now I get this image and send back. If I don't move them from position, everything's going to be superimposed perfectly. So now let's unlock here, ungroup, I'm sorry. And then here on image, I can then change the exposure. Change the exposure here, change the exposure here, and then we can start bleaching those teeth. So premolars, you should by now, we're recording this again, this movie at Nail Clinic in Bucharest in front of our beautiful audience. And you should by now thinking, what is my next step? Think it's a nice exercise for you. So now this is good. Let's duplicate the slide, and I want to see now the lips. So I'm going to erase this picture, and because everything is superimposed perfectly, I can go back here, make sure this is ungrouped, and do a copy of this picture with the lip. They should fall exactly on the same place, because from this, we used our transferring lines to get here. And from here, we design all the teeth. So this image and this image should be on the same place. Just send it to back. We can see it's on the same place. Let's duplicate the slide. And now I want to see the full face. So I can select everything with the Command A. Command A is a shortcut to select everything. Command A means Command All. I can group this. I can then reduce the size of my group. I want to see around, I want to see my full slide here, so I have a reference. Where can I place Raquel? Her face is going to show up here. Remember, I'm going to ungroup and take this photo. Remember that this picture is just behind that, on that position, but this picture is actually her face. So Command Z to go back here. This picture I can now mask, and actually instead of masking, I am sort of unmasking. And unmask means I can then select, I don't need to go all the way here. I'm going to cut a little bit the hair here because I want both images to fit the slide. And I get now the original image here, make a copy, Command D, put it here. Now I can select everything again and then place on in the middle of my slide. This way I create a nice before and after simulation. And with this, you have a full tutorial video very quickly of Raquel's smile design. Most important is the 8 steps, horizontal, vertical, smile curve, interdental ruler, transferring to the other line, transferring this to the model, then making your project the size, the dimensions, so the technician can do the wax up, and then painting the teeth, putting in the image with the lip, and then expanding, unmasking her, creating a before and after simulation. So this will help you to revise. I hope you can watch this video many times, and I see you on the next opportunity. Thank you.